You have just finished facelift surgery with intravenous sedation. This video will review with you the proper care of the surgery site, including what is expected in a normal post-operative course and what would be considered abnormal. Do not worry about forgetting some of this information, because before leaving today, you will be given written instructions and our contact information. Should you misplace this information sheet, these instructions can also be found on our website, GuyetteSurgery.com. Occasionally, the effects of IV sedation will make you feel emotional. This feeling will wear off as the sedation medication is metabolized. Immediately after surgery, a pressure dressing is applied that covers the entire area of the surgery. This dressing minimizes oozing and formation of a hematoma, which is a pooling of blood under the skin. It is expected that there will be some blood which drips from behind and below both ears. Place a towel under your head to catch these drips. You will be given a cold pack to place over your eyes. This pack can be reused. Cold will minimize the swelling and bruising that you experience in the front part of your face. You may also place a cold pack on your neck, just below the dressing. When you return home from surgery, sit in a recliner or on a couch with your head elevated and cold packs on your eyes, 20 minutes on, 20 minutes off. Crushed ice in a baggie or frozen peas can also be used. While cold packs are helpful up to 36 hours after surgery, it's not necessary to stay up all night changing the packs. Cold packs placed directly over the dressing will be of little use. The dressing will be removed at the first post-operative visit, usually 2 to 4 days after surgery. After cleaning and examining the entire surgery site, a more flexible and comfortable dressing will be placed. During the first week, it is best to keep your head elevated as much as possible. When sleeping, keep your head above the level of your heart, but you do not need to sleep upright. Extra pillows under your head or a blanket or two under the mattress works well. After the initial dressing is removed, at the first post-operative visit, you'll be instructed on how to properly care for the surgery site. Until then, there's little to do except keep your head elevated and place cold packs. Once you are home, drink and eat something light, such as yogurt, pudding, or juice. You may then take pain medication. You may advance your diet to normal as quickly as you wish. For those who are not allergic or taking blood thinning medication, the over-the-counter medication ibuprofen, also known as Advil or Motrin, works well as a primary pain reliever. For adults, 2 or 3 tablets of ibuprofen should be taken 4 times a day, at breakfast, lunch, dinner, and bedtime with a snack, for 3 consecutive days following surgery. Narcotic pain medications such as Vicodin or Darvocet is prescribed to help with post-operative discomfort not controlled by ibuprofen. Take this medication as directed on the bottle. You may alternate the prescription pain medication with ibuprofen or even take it at the same time if necessary. Antibiotics have also been prescribed. The instructions on the bottle will guide you when to take this medication. It is best not to take any medication on an empty stomach, as it may cause nausea. Please continue to take the anti-bruising medication that you were given and resume your normal medications after your first meal. Remember, do not drive for 4 hours after taking prescription pain medication, and do not take other sedative medications or drink alcohol for 4 hours before or after taking narcotic pain medication. Nausea and vomiting are an unwelcome and rare occurrence after any surgery with IV sedation. The main cause of nausea is taking narcotic pain tablets, especially on an empty stomach. The chance of post-operative nausea can be minimized by taking narcotic pain medication only if needed, and then only when you have something in your stomach. If nausea persists over 24 hours or vomiting occurs more than 3 times, call our office. Swelling and bruising are normal body responses to surgery. Swelling usually peaks the 2nd or 3rd day after surgery, stays for several days, and then begins to decrease. Much of the swelling is gone in 2 to 3 weeks, but the remainder takes many months to resolve completely. The final result can take up to 6 months or longer to achieve. Good nutrition is very important in optimizing healing after surgery. Make sure you eat a balanced diet. Nutritional drinks and shakes can supplement your diet to make sure that you are getting the nutrients that you need to heal quickly. Light exercise, such as evening walks, can begin 3 to 4 days following surgery. Do not lift heavy objects, bend over, or return to strenuous activity until instructed by me or our staff. On average, Moderate exercise begins 10 to 14 days and vigorous exercise 4 to 6 weeks after surgery. Infection after facelift surgery is extremely uncommon, but if you develop a fever over 101 degrees or progressive swelling after 5 days or note pussy drainage, contact your office immediately for an examination. Once you are home and have a question about how to care for your surgery site, refer to the written instructions that you will be given today. If you misplace these instructions, you can review them on our website, GuyetteSurgery.com. If after reviewing these instructions you still have a question or concern, please call our office. If it is after hours, you will be given instructions on how to contact me or the doctor on call. On behalf of the entire staff, I want to thank you for choosing us for your facial cosmetic surgery. Our goal at the Guyette Facial and Oral Surgery Center is to consistently provide the best, safest, and most advanced facial and oral surgical treatment to those patients who entrust their care to us. Should you have any suggestions on how we might improve our service, please let us know. If we can be of further assistance to you, your family, or friends, just give us a call.